Hello, I'm Phyllis Cowling, President and CEO of United Regional Healthcare System. I've been made aware recently of situations in which local residents who needed urgent or emergent care were hesitant to come to the hospital because they thought it was unsafe, that the presence of COVID patients would put them at risk. Nothing could be further from reality. In fact, United Regional may very well be the safest place in town. Why? Well, let me explain some of our current safety measures. First, we have limited facility access to one visitor or personal caregiver for each patient. In addition, everyone who walks into any one of our buildings is screened for potential COVID symptoms or exposure. While certainly not perfect, the process is extensive and effective. Also, the cohorting of COVID and possible COVID patients. These patients, if any, are appropriately isolated within dedicated nursing units with dedicated staff. These units are restricted as to entry with enhanced personal protective equipment or PPE and exposure prevention processes in place. Likewise, the emergency department, and for that matter, URPG at Barnett Road Medical Building and other locations, have established procedures for segregating and protecting patients from potential exposures. We're always attentive to infection prevention processes, including hygiene and disinfection. However, we are now hypervigilant, super focused in doing so. For example, to further conserve disinfection supplies and to concentrate those supplies to patient and public areas, we've also sent a number of employees to work from home. And maybe most importantly, we have infection prevention experts guiding our efforts. We're in constant communication with our infection prevention team, highly trained, informed, and engaged professionals who contribute to their expertise to our decisions and actions and answer questions as they arise, which is quite frequent. So please do not allow COVID fear to put you or a family member in a potentially life-threatening situation. Access care when needed. In addition, here at United Regional, we're further promoting our collective safety as our state and our community work toward reopening. Consistent with new CDC direction, we will transition next week to a requirement that all employees, practitioners, and physicians wear cloth face coverings or cloth masks throughout our facilities, unless in a private space or an area where they must wear PPE. This will then be followed soon thereafter by the same expectation of visitors and patients. Now, it's important to note that the purpose of cloth masks is spread control, to keep the person wearing it from spreading respiratory secretions when talking, sneezing, or coughing. It's how each of us can help prevent the inadvertent exposure of others around us, even if we don't exhibit symptoms. Wearing a cloth mask is simply an extra layer, literally, of precaution, of all of us doing our individual part in containing COVID spread. Finally, a quick thank you for your incredible support of our United Regional team over the past several weeks. Your written notes and social media posts of encouragement, your generous donation of services and supplies, including cloth masks, and your prayers for our team's safety have all been so meaningful and so very much appreciated. So thank you, Wichita Falls. Stay safe, and again, please access care when needed.